National Coordinator of the Defeat Malnutrition Today Coalition, and I am joined by our Chief Policy Director, Associate, whatever the terms are, Laura Borth, who will kick us off.
Yes, hello and welcome everyone. I'll pull up some slides here. So today, we're gonna, over a 30-minute webinar, gonna go through the federal policies that are shaping older adult nutrition and malnutrition in this administration, and then a little bit of noodling on where Make America Healthy Again fits in. So again, I'm Laura Borth. I am the policy director at Defeat Malnutrition Today, and Bob and I will be going through the slides today. So I think all of you are familiar with who we are, but we are a coalition of 130 national, state, and local stakeholders, including most of you. This includes community, healthy aging, nutrition, advocacy, healthcare professional, faith-based, and private sector groups. And since 2015, so a decade, we've been raising awareness about malnutrition, especially focused on older adults, and working to create policy change towards a greater emphasis on screening for, detecting, treating, and preventing malnutrition. In 2025, we do plan to focus on malnutrition as it is a persistent issue across the lifespan, not just in older adults, where up to 50% of older adults are at risk of malnutrition, but there is a risk of malnutrition in all age groups. And so today, we will touch on some of DMT's highlights from last year. Bob will take us through the federal budget process, regulatory front, legislative front, some federal agencies to look at, and then we will discuss a little bit of the Make America Healthy movement and other opportunities such as food as medicine. And so in 2024, we did some great things. We updated our state advocacy toolkit. This had been last updated during the COVID-19 pandemic. And this toolkit focuses on what advocates can do at the state level, including a focus on the master or multi-sector plans for aging, which are ongoing in over half of the states. We advocated for a successful expansion of the GMCS, the malnutrition quality measure. It is now, it originally focused on patients 65 and older, and now it focuses on patients 18 and older. Our executive director, Bob Blancano, co-authored a health affairs article on nutrition care and anti-obesity medication therapy. We're able to have our blog included in remarks that Representative McGovern gave on the floor last summer. And we co-authored a blog on Malnutrition Awareness Week with Representative Bonamici. Many of our other actions are not on this list, but these were the ones that really stood out to us. So with that, I will pass it over to Bob.
Right, and I'll just add that the expansion of the global malnutrition quality measure came as a pleasant surprise to us when we were told they're going to go to 18 plus, and so we believe that even doing quiet advocacy can work sometimes. So now let's talk about the here and now, and I'm sure everybody like me, and we've had 1 month of this administration, everybody's exhausted already. So 47 more to go, right? So I'll have to see how this turns out. That being said, let's talk about kind of where we are as of last night with the House passing its budget resolution, which, as folks know, that's the first big step in the process. The Senate had already passed their version of it. But the House budget resolution, contains targets, okay? Not specific numbers. I want to keep stressing this point. There are not specific numbers yet about what each committee that has jurisdiction over different programs has to produce in savings as part of this ultimate budget reconciliation bill, which follows. Now, the House Energy and Commerce has gotten a lot of attention because they were asked to come up with $800 billion in savings, which translated mostly into the Medicaid space. There are other programs under their jurisdiction, but Medicaid has gotten a lot of the attention. The Education and Workforce Committee, which covers the Older Americans Act, on the House side was asked to produce $330 billion, which, by the way, in contrast to the Senate, which only asked for $1 billion in savings from their same comparable committee, the Health Committee. The House Agriculture Committee, which covers the Farm Bill and federal nutrition programs, was asked to come up with $230 billion in savings under the House budget resolution. Now, let's put things in the proper context. The House and Senate are on two different paths with this reconciliation bill in so many different directions. Okay, the House bill would cover all the things that the president wants. The Senate bill will take it in two steps, with tax reform coming after the other provisions, right? So for them to come to an agreement on a budget reconciliation bill could take a couple months just to get this resolution piece fixed. And, you know, the committees are not going to jump ahead until they know exactly what their number is. Nobody's going to want to go out and make cuts until they know what the actual bill said for them to do. But there are targets that have been identified in documents that were produced mostly by on the House side before the process began, including calling for the elimination of funding for the Social Services Block Grant, which is the main funding source for adult protective services, provides also 240,000 meals for older adults. The SNAP program is always up. That's always a target. Even before this administration, it was a target. Rolling back updates to the thrifty meal plan and other things. But, you know, press reports are suggesting that the more they try to dive in and make cuts into the SNAP program, the harder it's going to be to get a farm bill produced later this year. And then some other targets on school meals are mentioned here as well. So, you know, a big step was taken. Okay, I mean, but it's not the final step, and there's many steps to go before this thing becomes real. So let's go to the next slide and talk about, you know, a more here and now situation. March 14th is right around the corner. And March 14th is when the most recent version of the continuing resolution funding the government will expire. And then again, you have your choices, the old scenario planning here. You can either extend that FY24 funding for a short period of time, a month, 2 months. You can pass individual funding bills for agriculture, HHS, and so on. Or you could end up with a year-long continuing resolution that would go right through till September 30th. And if they go that route, there'll probably be more things added to it as they go forward, okay, including things like telehealth and other health issues that have expired in the Medicare program, and possibly even the Older Americans Act, depending on a few things. And then, of course, right around the corner is fiscal year 2026, which begins October 1st. And we're waiting to see what the president is going to produce in his first budget in his second term. And we should have a good idea on that in early March. Next slide talks about regulatory front. I guess this is good news. You know, all seems quiet on the global malnutrition composite score measure. Okay, as many of you know, when administrations come in, the first things they do is go back to the previous administration's work, particularly if it's from another party, one party to the next, and go back and sort of rearrange their regulatory agenda, stop things from going forward, stop things in progress, whatever it may be. Because the first version of the global malnutrition was adopted in the 2022 CMS inpatient hospital rule, and the expansion to 18 plus happened well earlier last year. It's far enough back that it's probably not under the radar screen, but we will always be watching because you never know what could pop up, and we want to make sure that any efforts to roll it back, we would contest very strongly. So while we wait to see and hope nothing happens in that front, we're going to work to continue our work on the implementation of the malnutrition quality measure. We're going to have a webinar later this year to talk about who's done well with it. The thing that we're most interested in is the all-important connection between hospitals and community-based nutrition programs. So when the individual who may have come in diagnosed with malnutrition can leave and not be readmitted to the hospital because they will have access to community-based nutrition programs. But we're finding that there's just too many places that don't have those good relationships between a hospital and a community-based group. So our role is to try to be that bridge that puts them together. And we have been in contact with a number of hospitals and emergency EMRs on their updates. we're going to be focusing a good amount of attention on the age-friendly measure adopted by the Centers for Medicare and Medicaid Services that mandates hospitals to have age-friendly procedures, something that began January 1st of this year. Age-friendly was what matters: medication, mentation, and mobility. And under mentation is frailty and malnutrition screening. And we are going to be looking at that very closely. We're also monitoring to make sure, again, going back to the first point, that if there's any new regulations that come out under CMS's purview, they want to get rid of 10 regulations for each new one that are proposed. I don't know how far back they'll go, but that's one area that we'll keep an eye on to make sure. And you can expect fewer regulations overall from this administration. Next slide, I think is yours, Laura, if I remember right. Yeah.
Yes, I just wanted to call your attention to the Nutrition Month webinar that we'll be hosting at the end of March. And we are partnering with the John A. Hartford Foundation, who is one of the stewards of the age-friendly hospital measure. And we'll be having a hospital come onto the webinar to talk about how they're focusing on malnutrition in that age-friendly hospital measure. So keep your eye out. We'll probably have some materials on it in the next week or so that we'll be sending around.
And let me take a moment to let Therese introduce herself now that she's got connected to audio.
Oh, hi. Hello.
Hi.
Hi.
Yeah, I'm a registered dietitian. I'm semi-retired. I work on malnutrition and sarcopenia.
Well, great to have you. Thank you. We will look forward
Thank
to
you.
your comments as they come along. And Joe, are you able to connect yet? Okay, we'll keep trying. Let's go on to the next slide. So on the legislative front, as we move into 2025, the Older Americans Act and its possibilities of being reauthorized. This is one of the great frustrations that our coalition and a lot of other aging organizations felt last year when we got so very close to having the reauthorization completed in 2024 when it was supposed to be. The Senate passed their bill in December. The House was prepared to move on a bill that, had they done that, then the Older Americans Act would have been attached to the final bill that came out of Congress in December. But it didn't happen. So now it's a question of how do we revive it? When do we revive it? And what version do we use to get it done? Major aging organizations, including NAS, Meals on Wheels America, U.S. Aging, National Council on Aging, and Advancing States have all said last year's bipartisan bill S4776 is the perfect vehicle to use. It's been vetted, so to speak. It's got a lot of good provisions in it. It strengthens the nutrition program. It's a 4-year reauthorization. It increases funding for each year. It allows flexibilities like grab-and-go meals to continue, maintains malnutrition screening and prevention in both state and area plans on aging. So our position is to the House and the Senate, move on this bill, get it done early, even as early as getting it attached to the next version of a funding bill back on or before March 14th. So stay tuned. We'll keep you posted on how that progresses. The Medical Nutrition Therapy Act, another bill that was up last year but didn't get finished, to expand Medicare coverage for MNT. There again, if there's a bigger continuing resolution that has health legislation attached to it, MNT could find its way onto that bill. The Treat and Reduce Obesity Act, there's no question that's going to move. And the House, on the House side, the Ways and Means Committee has already weighed in, urging that last year's amended version of TROA get passed. The bill would allow Medicare to cover obesity drugs, but only for those who are currently taking the medication. And also directs HHS to review national coverage of intensive behavioral therapy for obesity. And then finally, as I mentioned before, we have the Farm Bill up for renewal. It was extended through September of this year, but it's a long way from having the pathway to be reauthorized. They normally do it for 5 years. In this environment, it's going to be a little tough to get that kind of a long extension of a farm bill. but we're monitoring that because 80% of that bill is domestic nutrition programs. So, you know, this is not, doesn't come as any news to anybody here. I mean, we have some new players in town. And of most importance to our work is the Secretary of HHS, Robert F. Kennedy Jr., and the Secretary of Agriculture, Brooke Rollins. And, you know, as was mentioned earlier, you know, one of the priorities that have been identified by Secretary Kennedy is making America healthy again and focusing on reducing chronic disease. And we have already communicated with the Secretary about the need to ensure that nutrition has a proper place overall in making America healthy again. But also, if we're going to be focusing on chronic disease, let's ensure we include malnutrition as a chronic disease that we would want to help prevent. Next slide. And, you know, our expected work, you know, there's a lot of activity already going on around Make America Healthy Again. The commission was formed by the president at the same day that Senator Robert Kennedy was sworn in. There's a caucuses in both the House and the Senate. States have already introduced dozens of MAHA aligned bills. And, you know, the focus on chronic disease and nutrition, and where would the dietary guidelines fit into this overall conversation? There's some talk about them wanting to go back and review the process. But from our vantage point and to our members, we say we want to see nutrition play a key role in improving health and preventing chronic diseases. And malnutrition is a chronic disease and needs to be addressed. And nutrition needs to be in all and any obesity care plan. And, you know, if you see anybody on that list that you are close to or in their district or state, feel free to send that message to them as part of the developing work around MAHA. And Laura, I guess you're next.
Yeah, I wanted to call our attention to a couple other opportunities in the legislative front. There's been a growing movement in the Republican Party as well as the Democratic Party on this idea of food as medicine. So we can expect more pilots being introduced on meal delivery, grocery delivery, and more. So there's really an opportunity for DMT and other nutrition-focused organizations to communicate with folks on the MAHA caucuses on, you know, what would be good ideas for expanding food as medicine. And there's, of course, an opportunity to incorporate malnutrition in that. And then Representative Vern Buchanan, he actually founded the Bipartisan Congressional Preventive Health and Wellness Caucus in 2024. And last week, he wrote in The Hill an article called "America is Sick, Healthier Food Can Help Patients in Recovery." And he, while not a chair of the MAHA caucus, has been involved in that. And so I find this really encouraging on this focus on preventative health in this whole movement. And so, you know, here we are, a brief overview. I'll pass it back over to Bob.
Yeah, that's, you know, we have been taking solace or hope, if you will, in the some words that have been given to us by former President Obama in terms of, you know, the need for forging alliance and building coalitions is as strong as ever as we confront, you know, some of the changes that are going on here. And, you know, Senator Kane says it right. Raymond, he's our senator. We love him. And he said it right. You know, you can advance where you can. Opportunities will be there, but we must defend as well where we see, you know, needs to protect. So that is our report to our friends on the webinar, and we'll be happy to handle any questions or comments that people might have. So what's in the chat here? All right. Thank you, Therese, for I see your thing in the chat. Thank you for that. Appreciate that.
And I have a direct message from Joe. He's having a mic issue and he's a dietitian in the Pennsylvania area. He works mainly in long-term care and is working on a malnutrition implementation guide for their company.
That's great, Joe. Thank you for doing that, and thanks for trying to join us today. Raymond, anything from you?
When we talk about food as medicine and partnering with health systems, and one of the things I attempted up here in Prince William, and it might have more success down in York. I reached back to 1982 when I was in nursing school, manual diagnosis, and just for and it ties in with what Therese said. There is a specific nursing diagnosis that's part of a nursing care plan as self-feeding deficit, inability to feed self when food is available. And it comes to different level, but that's one of those ties back in outside of having a care person there to help with the food, but with the food. And I've already used this argument and I've got some people thinking on it at Riverside Health System. And my wife started laughing because she said, I thought you threw that out when we both left nursing school. So that's just an idea is within the electronic health record, when they do nursing care plans, particularly with the focus again, transition hospital to home again, wherever a home may be, is there's that care plan. We make sure they get their medication, but it's a hit and miss on who makes sure they get food. I think Bon Secours in Richmond is trying to initiate a program. Now, as my couple of cousins who are nurses up in Mass General, they've got a whole roof that's covered with a garden. So they send people home. And Riverside is looking to expand on the Farm Fresh program that is run down at the landing. We'll kick back into that here in warmer weather. But that's kind of all. I'm using my talents to rattle cages, Bob, and see who I can bring back an old idea to. And interesting enough, holding up a book from 1982 that's dog-eared and note cards is an effective tool.
There you go. Well, you keep doing that, Raymond.
Yeah, and I've attempted with much Congressman Whitman, since he is my congressman down in Yorktown. He's very difficult to try to get a sit down with, even an aide. So, but I keep knocking on the door.
You keep, I'm sure you will. You keep, and we are knocking on the door of 2:30, and we wanted to give you 30 minutes of a webinar, and we appreciate you taking the time to join us, and we hope you'll stay involved with us and stay in touch with us, and we wish you the best and the rest of a good day.
Bye-bye.
Bye,
Bye,
thank
everyone.
you.